Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. A new study reveals a significant number of nursing home residents are kept on venous catheters or IV lines long after antibiotic treatments have ended, exposing them to unnecessary health risks. Published in Infection Control and Hospital Epidemiology, the study found IVs should be removed the same day antibiotics are completed to prevent complications such as infection or blood clots. Researchers analyzed 720 residents across 6 California nursing homes between 2015 and 2018. 80% of the residents had catheters left in beyond the necessary time, with about one-third having them for a week or longer. Delay resulted in an average of 6.8 extra days spent in the facility. The study did not investigate why removals were delayed, but pointed to the absence of standardized protocols. Many nursing homes lack high-fidelity mechanisms to ensure timely catheter removal, highlighting the need for improved training and procedural oversight. While doctors typically visit nursing homes only once or twice a week, researchers argue that nurses who are present daily should be empowered to remove IVs promptly. Incorporating responsibility into standard catheter care training, along with better use of EHR, could help reduce delays and improve patient outcomes. Despite having the highest suicide rates in the U.S., older adults are often excluded from online suicide prevention initiatives, according to a new study. Most national suicide prevention organizations lack easily accessible resources tailored to older adults, leaving critical gaps in support. Investigators used Google to search for the suicide prevention organizations and reviewed top-ranking websites. Of the 7 organizations analyzed, only 5 acknowledged high suicide risk among older adults, yet resources specifically for this population were scarce or difficult to find. 4 of the organizations were federally funded, but focused largely on the younger demographics. According to the CDC, adults aged 75 and older have some of the highest suicide rates in the country, attributed to social isolation, loneliness, and underrepresentation in suicide prevention research. Current online efforts are imbalanced, failing to meet the needs of older adults, stressing the urgency of targeted suicide prevention campaigns for older individuals. Researchers hope findings prompt organizations to create more visible and accessible resources to better support this vulnerable population. Strengthening the nursing workforce and increasing recruitment, including international caregivers, tops AHCA's 2025 policy priorities. Tuesday, AHCA unveiled The Better Way, a 24-page platform urging the Trump administration and federal lawmakers to collaborate on protecting access to LTC, calling for proactive solutions prioritizing residents while addressing systemic workforce shortages. Despite nursing homes having the largest wage increases of any healthcare sector during COVID, the industry still needs 63,000 workers to return to the pre-pandemic levels. The federal staffing mandate, if implemented, would require an additional 102,000 staff. Key workforce initiatives include addressing faculty shortages at nursing schools, streamlining legal pathways for international caregivers, expanding career ladder programs, and providing financial incentives such as student loan forgiveness, tax credit, and housing support for LTC workers. The association also advocates for lifting bans on in-house DNA training and improving Medicaid reimbursement to cover 100% of patient care costs rather than the current 82%. AHCA is also pushing for reforms in Medicare Advantage plans, emphasizing care decisions should be made by medical professionals rather than insurers or AI-driven pre-authorization systems. Also urging CMS to modernize the 5-star rating system, incorporating more timely QMs rather than relying heavily on outdated survey data. They also want risk-based surveys to be expanded nationwide to reward high-performing facilities and reduce survey backlogs. Additionally, AHCA is calling for better access to CMP reinvestment funds for workforce tech improvements and stronger support for struggling facilities under the SFF program. With ongoing Medicaid reform discussions in Congress, including a potential $88 billion in cuts, AHC warns reductions could severely impact vulnerable seniors and continue to advocate for full Medicaid funding and policy reforms, ensuring LTC providers can meet growing demand for high-quality services. Thank you for joining me for News This Week in Nursing Homes. To get more of QSource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.